Coming up today, a competitor turned cancer survivor, Mila Ellsworth, learned to adapt to a new normal, but only after a treatment plan that matched her complex diagnosis. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. After Mila Ellsworth felt a lump, doctors confirmed that she had breast cancer. But it took special expertise to realize that she had two different kinds of breast cancer at the same time. Today, we are learning the important nuance needed to treat cases like hers, plus the lessons Mila learned through numerous treatments and surgeries. So we are glad to have Mila in studio with us today. Along with us is her medical oncologist and breast cancer specialist, Dr. Priyanka Sharma. She is also the program leader for the Drug Discovery, Delivery, and Experimental Therapeutics Program at the University of Kansas Cancer Center. Dr. Sharma, good morning.
Good morning.
Good to have you. Mila, I want to start with you before we go back and learn more about your diagnosis. How are you doing today?
Doing awesome, doing amazing, and just enjoying everyday life right now.
So, about 9 years ago, next month?
March 4th, will be 9 years.
It's a date you'll never forget.
Absolutely.
Right? So you were actually diagnosed at a different hospital. What about your results made you then seek out the University of Kansas Cancer Center?
Well, first of all, when I first met them, and they told me if I was stage 4, then I needed to be at KU. And I was stage 3. And through my biopsy and trying to come up with the results, everything was coming back inconclusive several times. And I didn't want to be at a hospital where I was their worst case patient. I wanted to be somewhere that they'd seen it before and they knew how to treat my cancer.
And you had a good chance, right?
Yes.
So let's just go back a moment, though, to the day that you learned you had cancer, stage 3. You have young children. What was that like for you?
It rocked my world, you know, to know as I have these 3 children that I'm supposed to raise and see grandkids, and it was something that you never expect to happen, and I hadn't had any cancer in my family up to that date, and so it took me by surprise. And my family, you know, and my friends surrounded me and supported me and got me through it all.
Did you feel that lump yourself? Had you been getting regular mammograms? How was that discovered?
No, I was too young to get mammograms.
Yeah.
I had just found it myself. I had gotten out of the shower and was putting lotion on, and I felt it. And I knew something was wrong immediately.
And you took action.
Yep.
Dr. Sharma, is it standard to test each tumor to try to figure out what type of breast cancer it is?
It is. It can. Breast cancers, there are 3 major types of breast cancers, and typically if there is more than one spot in a breast, they tend to be similar phenotype or similar types of cancers, but that is not always the case. So our practice is always to test each separate, if they're separate tumors, test them for the 3 common markers that the breast cancer cells express to ensure that we're able to tailor the treatment to the exact cancer that the patient has. And if there are 2 different phenotypes or 2 different types, then we come up with a way to make sure that the treatment recommendations are going to be able to match both the types of breast cancers.
But Dr. Sharma, how often does that happen, to have 2 different types of cancer going on at the same time?
It's not very common. I would say it's less than 10%, but it is common enough that we should be looking for it, and we should ensure that this is not the case if a woman has 2 different sites of cancer. A patient can have cancer in both breasts, and again, it's the same principle that if a patient presents with 2 areas of cancer in 2 breasts, then we should test both sides to make sure that they're to know what they are, so we can make sure that our treatment recommendations match the type of cancer.
And so in what ways were these 2 different cancers different?
So the 2 cancers differed in the expression of the protein called HER2. One of them was HER2 positive and the other one wasn't. So we made sure that the treatment recommendations include an anti-HER2 therapy that would address the HER2 positive cancer along with the chemotherapy, and the other cancer that wasn't HER2 positive needed also chemotherapy. So we made sure that the chemotherapy backbone that we were recommending could be appropriate for both types of cancer, the HER2 positive cancer and the HER2 negative cancer. And of course, the cancers did express estrogen receptor, which is typically for which we typically recommend oral anti-estrogen therapy that comes after surgery. So the initial step for this type of cancer was a combination of chemotherapy along with anti-HER2 therapy, and we made sure that the chemotherapy regimen recommended could address both types of cancers.
So I want to turn back to Mila now and talk about genetics. You actually tested positive for the BRCA gene. It's inherited. Did you then share that news with your family? When did those conversations start to happen?
Absolutely. I actually started the conversations with my sister prior to even getting tested, just because I knew that this could impact her and wanted her prepared for it. So once I found out I was positive, I had my mom and dad got tested to figure out what side of the family it was on, and then it was on my dad's. So then we went and had my aunts and uncles and cousins, and even my sister. There was a lot of them who had then tested positive, and each one of them has chosen their personal preventative care on how they wanted to take care of themselves.
So you dug deep into the past, but let's talk about the future. You have 3 kids,
Yep.
2 young girls. What will those conversations look like? And have you talked with Dr. Sharma or your genetics counseling about what you need to do moving forward?
I talk to Dr. Sharma every time I go in to see her, to see how research and medicine has changed and how to talk to my kids. And it's an open conversation in our household. Obviously, there's a little bit more in-depth conversation that now I have a 16-year-old. But in every year is a different maturity level on how to be able to handle that information. So we'll continue to talk to her, and when there's a time and ready, they know they want to get tested, but it's just when they're ready and to be able to make those tough decisions and be able to handle that, then they'll get tested.
Dr. Sharma, just on an expert level, what and when should those conversations happen if this is something that's in your family history?
And I think, as Mila pointed out, a lot depends on the mature, and if you're talking about children, maturity level of the children. Typically, the conversations about actual testing, we do not suggest till age 18, and often till age 21, because what we would learn from it would impact our recommendations for screening and monitoring only after those ages. And then by that time, the individual is more mature to kind of handle the information that would come and understand the pros and cons of testing versus not, and understand the repercussions of a positive versus a negative testing. The typical screening recommendations will start somewhere after that as well. It is all based on the family history and when the youngest person in the family had breast cancer. So in most cases, the screening typically isn't starting till about mid-20s. So my normal suggestion is to wait till they're 18 to start talking about the idea of getting tested, and often I see most of my patients' children waiting till about 21 to actually get tested. By then they've made some decisions about what they want to do with their life. Perhaps chosen a career, have gone to college or made decisions about what they're doing, and so this doesn't impact the decisions about what they're going to do with their life. It's something that we can manage with screening and recommendations and follow-up and being seen in high-risk clinic in case of a positive test.
Yeah, it's all about getting ahead of it for sure, when you have that knowledge and getting that genetic testing.
Absolutely.
So you're a busy mom of 3, you're a softball player, you're an athlete, I shall say. How did you adapt to the new normal? Because chemo, radiation, even hormone therapy, did you accept that this was going to be a new normal, or are you always trying to get back to how it used to be?
I think you always try to get it back to how it used to be. And the original thought was, after chemo, radiation, and surgeries, that you go back to normal. And I think at that point you realize there's just a new normal. And I think the number one thing is just the fear of reoccurrence. That's always in your head and always in the back of your mind. That's going to affect. I also have lymphedema from getting my lymph nodes removed.
And you're wearing a sleeve, actually.
I am wearing a sleeve.
And you wear it daily almost, right?
Every day. And it was hard at first, like, okay, this is what I do. And then the mindset of, oh my gosh, this is every day for the rest of my life. It was hard. And then I learned to just embrace it. And I have different colors. I got pink and blue and black, match colors and outfits, and just kind of own it and embrace it.
It's like the Michael Jackson glove.
That's right.
You just got to embrace it, make it cool. But I bet people ask you about it, because I did. I thought I was about ready to ask you, did you spray in your hand?
Yeah,
and then I remembered.
I wish it was that easy.
I know, like throwing your softball, a good old softball injury.
Yep.
But Dr. Sharma, is lipedema a pretty typical after effect when this happens? Tell us a little bit more about that.
So it is, with preventative measures and regular measurements and follow-up, we think we're making an impact on the incidence of it. For the kind of treatment that Mila had, which required surgery and radiation, the risk is probably like 1 in 5, maybe a little more than that. So it's not small, but it's not very huge either. And one of the challenges with lymphedema is it can happen, even a few months or a few years after the initial treatment. And the women and patients who are on top of it, like make sure they're wearing their sleeve, doing all the right things to keep the symptoms down, are most functional after it. Women who are overweight are at higher risk. Women who have to get both the axillary or the lymph node surgery and radiation are at higher risk relative to women who do not need both. And in Mila's case, she's clearly very fit. So, besides the risk of the treatment, she didn't really have any personal risks for it.
And Mila, you had several surgeries after your cancer treatment. Were they focused on reconstruction? Because we know that's part of the story.
Yes. So I had some reconstruction, which was a little bit different route because I didn't have the body fat to do the flap surgery.
Because you were so athletic and had such low body fat, they couldn't take it out of your stomach.
They could not take it out of my stomach. And I wasn't willing to compromise my muscles to them to take it from a muscle. So we tried to just have regular implants put in, and unfortunately the radiated tissue just did not want to heal. So then that left us with the option of taking flaps, 2 flaps, one from each inner thigh, and replacing the radiated tissue. And then after going through that surgery and recovering, then they were able to go back and put an implant in it.
Not an easy road, I take it.
No, not at all.
So you've been doing some work raising money for breast cancer patients. Tell us about these Pink Out games. What is that about?
So St. Thomas Aquinas started a Pink Out game for me 9 years ago. And it was a very humbling experience for me, for the support of my friends and family and those who I didn't even know. And so I wanted to continue being able to give back and do it for others. And so now we've made it an entire spring sport event, and the student body and the faculty of St. Thomas Aquinas is fantastic in supporting our recipient every year. And this year it's April 23rd.
Nice work.
Yeah.
Nice work. And that must feel good to be involved in this community.
Absolutely.
You've also made a big point to travel more, live life more, live it better. Tell us about that.
Well, to being diagnosed, and especially with the kids at a young age, you just realize that you don't have control of life. And there's times that you put off things because, you don't have time for it, but the memories that we can make with my family now are irreplaceable. And so there's no reason to wait. And so we're going to live life every day, and we're going to travel and see the world. And we've seen a lot of cool places. And we're planning a big one for my 10-year next year.
What are some of the options?
Our number one option right now is try to get to Thailand and go to Phuket. But there's a lot of details to work out. But we're gonna make it a bang. So
that's a great goal. Great goal. Okay, so on that note, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's turn now, get a co-account from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning.
Yeah, hi.
Hi.
Yeah, good. Again, COVID count 21 for this week, so down just a little bit. Hopefully this number continues to trend down. There's still good circulation of SARS-CoV-2 out there in the community. Hoping we aren't going to see any increased circulation of influenza, particularly influenza B, but I think we just need to see how these next couple weeks go.
So, Hawk, new research posted by the CDC last week shows an increase in Lyme disease. This is a tick-borne illness. But the numbers can be misleading because the CDC changed how the cases are actually reported. So what was that change, and how big of a problem really is Lyme disease here in Kansas and the Missouri area?
Yeah, I think that's right. They just kind of tweaked their definition. It's always important to get a definition. We've talked about long COVID and how difficult it is, just because it's difficult to get a full definition of long COVID, so that we can properly identify it and find interventions to help with that. Same thing goes for any medical illness. We want a proper definition. They kind of tweak the definition based on some symptoms as well, not just lab testing. But I think the story here is that where Lyme isn't. So there are significant areas of Lyme disease. Closest to us would be Minnesota or Wisconsin. And in 2022, Minnesota had 2,600 cases of Lyme disease diagnosed. Again, most of these are probably going to be through blood tests. And Wisconsin had 5,200 cases of Lyme disease. We know that people, whenever they even see a tick on them, they are concerned about Lyme disease in general around here. But we should state that in 2022, as compared to Minnesota and Wisconsin, Kansas only had 9 cases of diagnosed Lyme disease, and Missouri had 7. So very low incidence. We know that there are other more significant or more prominent tick-borne illnesses around. Those include Rocky Mountain spotted fever as well as ehrlichiosis. But I think this is also another point to educate the people. So we are going to come shortly into the spring and summer weather, and obviously we know it's overall been warmer. We haven't had those hard freezes. That helps cut down on the tick population, also the mosquito population. We unfortunately just heard about that tragedy of that Blue Valley Southwest coach who recently passed away after contracting West Nile virus from a mosquito back in October. But overall, we are talking about vectors here. It is going to be important as we get into these warmer months now and people are going to be out to protect yourself. We'll have more information about that later, but the best thing you can do is wear that bug spray to help prevent those ticks and mosquitoes from biting you.
Hawk, thanks so much.
Yep.
We're going to get to some questions from our viewers right now. We're going to kick it off with a comment from Georgianne. She says she's really impressed that you researched the family origin of the cancer and that the family then went to get tested. So that just such invaluable information for them to save lives. So on that note, another question is, did you go to a genetic counselor, and what was the testing like, and how long did it take for you to get the information back?
Well, when I met with Dr. Sharma, going over kind of what type of cancers and the markers and everything, she really encouraged me to get tested for the genetic testing, just because she was like, I just want to know everything that I'm dealing with and everything that's involving your cancer. And so I went and got tested. It probably didn't take too long to get the results back, maybe a week or so. And then, like I said, shared it with my family, and they were all very open to get tested. They all got tested and got their results back. I wish I had the opportunity to have known and to be tested, so it would have changed my course. It may have not stopped my cancer from coming, but maybe not gotten to my lymph nodes or stage 3.
I'm so glad that you shared that, because a lot of people just don't want to know. I've had stories on here where people go, I didn't want to know, but knowledge is power.
Yeah,
which is key. Jeremy wants to know, Dr. Sharma, should everyone look into getting genetic counseling or genetic testing if they have breast cancer? Is that something anyone who's had breast cancer should do? Oh, I think you're on mute, Dr. Sharma. Thank you.
So I think it's a discussion that all patients should have with their care team. There are certain criteria and guidelines that we have in place by national societies that help guide the decisions about which patients should be tested. Having said that, most patients that are younger than 50 years of age at the time of diagnosis, any patient that has more than one family member that has had breast cancer, and that takes into account both sides of the families and up to second and third degree relatives, should get tested. Patients who have any family history of ovarian cancer in the family should get tested. So the guidelines are quite broad. A majority of patients meet those guidelines. And even for those that don't meet guidelines, there are avenues to get tested where there might be a little bit more out-of-pocket cost. So I have this discussion with majority of my patients. We have to remember that only about 7% of breast cancers occur in the setting of a genetic mutation. So when we do the test, more often than not, we're expecting a negative result as opposed to a positive result. And I have that discussion with my patients as well, and we talk about if the test is positive, then we'll discuss the implications of the test, because a lot of recommendations are also based on the type of mutation that is present. And as Mila pointed out, often when we hear, oh, I didn't have any cancer in my family, it is possibly because the mutation was coming from the father's side, where, and then there weren't very many aunts that lived beyond a certain age on that side, so there weren't individuals living beyond a certain age, or not enough women on that side to see the breast or the ovarian cancer, which are the more common cancers that occur with the BRCA mutations.
Mila, question for you. How did your husband take the news?
I think it was hard because I think for both of us, like, we had not experienced cancer in our families, so we didn't know what the road was going. And I know he had a friend who his wife was diagnosed, and I know he had put a phone call out to him, and just to wrap his head around what it's going to be like to be able to support her, and what's life going to be like on a daily basis. And I think his biggest advice was, because the friend was 5 years removed, and he's like, we got through it, and I don't even look back and remember it too much. And so it was comforting to him to know that, you know what, like, we're going to be on the other side, and it's not going to be, that day to day is not going to be so hard.
And it's hard to see that when it's right there in front of your face, like you said, every day. But to know that there's over and beyond. On that note, though, how did you and your husband tell your children? What was the hardest part? Because there's somebody out there who's going to have this conversation today, in the future. What advice do you have?
So, and I maybe get emotional every time I talk about
That's
this.
okay. You can do it here.
So for me, one of my hardest things is I had to know that my kids were going to be okay. And if whatever happened in life, they were going to be okay. So
what do you mean by that?
That without a mom. Okay. So I had to have a conversation with my husband and asked him, are you guys all going to be okay without me? And sorry.
That's okay. You're going to make me cry too, so let's just do it.
He said, yes, we're gonna be able to do this, and we're gonna get through it. And so that allowed me to not stress on what could happen or what outcome was gonna be, in me to battle and fight the battle at hand, and put my focus on battling the cancer. And so it made it easier for then me to talk to each kid. Now, my kids were 2 and 4 and 7, so each conversation, each conversation was different with each one of them. Well, some of them was just like, hey, mommy's gonna lose her hair. Some was, I was coaching, and I was, I didn't know if I was gonna make it to all their games or not. So, hey, I'm going to try to be there, but we just didn't know. We didn't know how I was going to react to chemo. And so I really made it a point to not let chemo defy who I was. And if they had a 9 o'clock game and I was tired, I went to their game. I didn't miss a game. I didn't miss a coaching aspect. I didn't want it to change their lives. And they probably remember, the older ones remember me being bald and wearing hats all the time. They remember my surgeries. They remember me laying in the hospital and them coming to visit me a lot. But they also saw me fight and battle and get on the other side of it. And if anything and they would get diagnosed, or if any one of their spouses or children, they know that you can fight and you can get through it and you're going to win it. So it gave them a strength as well.
Thank you for sharing that. It's really important. Are you cancer-free?
I'm cancer-free.
So how often do you get checked? What's the future look like for you?
Well, right now I go see Dr. Sharma once a year. And
I bet you enjoy that.
yeah, it is.
You two get back together.
These appointments are way better than they were 9 years ago.
Right.
So it's fun. We get to discuss, what new research has come up, what the plan is for my kids, what's the plan for next year, because the plan, 9 years ago, being diagnosed, things change so often. So I'm always like, hey, okay, what's the new plan, this and that, and it's just fun to learn and learn what my kids are gonna have to deal with. And I hope by the time that if they ever have to deal with this, that there's a cure and they don't have to go through what I did.
It's advancing every day, but that must feel really good. You feel so out of control when you're diagnosed, but to know that it starts with you, and now they have this knowledge going into their young adult lives to get ahead of it.
Yeah, absolutely.
And kick it right where it belongs. I want to get our takeaways today. I'm going to start with Dr. Sharma. Dr. Sharma, great to have you. Just any message you want. What's the takeaway? Anything you want to share with Mila?
Well, Mila's shown tremendous strength and has done so much work to give back. This is really incredible. And as she pointed out, having this diagnosis at a very young age with young family is hard. I mean, it's hard in any situation, but it's particularly hard. I always, one advice I tell every woman is, be your advocate. If you are if you're encountering or an illness, cancer, or anything else, make sure that you feel comfortable and satisfied with your care team. You're asking all the questions, and you advocate for the best care for yourself. And if that means a second opinion, talking to friends, colleagues, other survivors or individuals with that illness, so be it. And the technology and our treatments advance every day. So we get better and better at providing better care with lesser side effects. So it's not just better drugs, but also helping the side effects and the long-term survivorship, especially when it comes to cancer care.
Dr. Sharma, thank you so much. Mila, what's the takeaway from your story?
Well, I would give any advice is to get checked early and get checked often. And those who are battling, embrace the support of others around you. Find a doctor who you can trust with your life, and I did, and thank you, Dr. Sharma.
And do your self-exams.
Yes.
It paid off. Thank you so much to both of our guests today, and thanks to our viewers for being with us. We'll see you back here tomorrow at 8.
Instead of 6 weeks of radiation, imagine needing just 1 second of treatment. I'm Alexis Del Cid on the next Open Mics with Dr. Stites, the amazing promise of flash radiation, which could spare your tissue and your immune system. We ask how close this medical breakthrough is to reaching patients. Wednesday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.